Good morning, Rejeena.
Good morning, ma'am.
Good morning, ma'am.
Good morning. My name is Rejeena, one of the OET aspirant and admin member from EduSkills platform. I'm very happy to be in front of you. And yeah, I hope that you all are fine and eagerly waiting for the session. Yes, before moving to the session, I would like to say, as Father said, a few words about our platform. Yes, we have started with the benchmark 3 study plan, and yeah, as we had completed other 2 benchmark study plan 1 and 2 successfully, hope that this also will complete very successfully. And we need your cooperation, and we are sure that we can do everything with the support of yours. And again, EduSkills platform is a non-profit platform which is guided and supported by our beloved Father Saleen and our group of admin members. And as I said that it's a non-profit platform, it's like you will get everything without paying any single penny from here. And as Father said that, people are spending a lots of money everywhere in order to get a better qualification, but see that whether you are getting it properly or not. And our kind advice is follow the proper strategies. OET is it's a competent exam testing our competency. So we need to know what's tips and tricks too in order to tackle all the questions. So how to do proper training, or how to practice properly. This is the kind of advice which I would like to give you today. Like, as we know that many of you are beginners, make a fixed timetable for your study plan and go with in a systematic way. Without systematic study and proper study plan, you will not reach anywhere. So in order to do that, Father had helped us by giving multiple videos in the YouTube. So watch each videos very thoroughly, especially if you are a beginner. Take one particular video, for example, reading part A, and then practice it. Watch it. First watch 1 or 2 times very clearly, not while you cook or not while you do anything else. Sit in front of with the book and paper and watch it very clearly, and make sure you understand everything from that video. And then you take another task. Another task, and then you try to apply all the strategies onto that task. Maybe you get less score, it is usual. And then if you have doubt, again watch the same video, give time until you get 20 out of 20 for the A part. You watch the video and you practice with the same material. When you complete all those, when you finish with that particular task, then you watch the second video of that specific reading part A itself. Try to complete all the videos. We have multiple videos in our YouTubes, which is done by either Father Saleen or many of the student faculties. Watch all the videos very clearly and make sure that you are sure with reading part A. Take time. It takes time. So try to spend 1 week or more than that for reading part A itself, and try to be comfortable with the reading part A, then move to reading part B. While practicing reading part B, of course, you can side by side, you can do reading part A as well. So by the time you are sure with all the strategies from the reading part A, so that it will be very easy for you, you won't take much time. It will take less than 13 minutes or 15 minutes, and with the correction and everything, only maybe 20 to 25 minutes for reading part A. By the time, step by step, you can proceed with the reading part B on the same way. Watch all the videos, and at the same time, you do another task as well. Like reading part B, you take a separate test and try to apply all these strategies. Watching the video itself, you will not gain anything. You may feel that you are competent, you know everything, but unless you apply onto the task, you are not going to gain anything. So try to apply those strategies onto them. If you are not able to apply, just again rewatch the video, then Same like that, you can move to the reading part C as well. So once you are thorough with reading, slowly you can move to other modules also. Like if you want to start with the listening, do the same with the first listening part A, then B and C as well. And once you are thorough with that, move to this one. Please give more time if you are a beginner, and try to be comfortable with all those modules which you had practiced, and then move forward. Otherwise, don't mix everything together. You will be confused and you cannot love the process. Unless you love the process, you may, like, we know that we all of us are working and we have so much of family responsibilities and many other responsibilities as well. So what we need to do is love your process. As always, EduSkill, Father always tell us, love, unless you love your process, you cannot proceed your steps forward, because OET is not a short journey. It needs time. Unless you are very competent and you are special in everything, it need time. Okay, so for a beginner, my kind advice to the beginners is give time, make a time frame in front of you, then move forward in a step-by-step manner. Try to watch all the videos, and another request is, while watching, kindly share, like, share and subscribe the video so that it will reach many others who are really in need. That's what I want to tell you today. Take it as an advice, and then move forward. You will achieve your dream. So now I would like to move to my own responsibilities. That is, today's responsibility is dealing with writing tasks. Okay, can you all see me? See my slides?
Yes.
Yes, Rejeena.
Yes, ma'am.
Okay. Okay, fine. Okay. Please, if you have doubts, just write it in a paper, and at the end we will discuss. Okay. And please keep in your mind that, while during the discussion, keep your mic muted, because, I spend maybe last 2 hours to prepare the slides. In order to edit this video, Father has to spend maybe another 4 hours or 6 hours, more than 4 to 5 hours in order to edit this video. So kindly mute your videos. Don't disturb in between the classes. It takes lots of his time, because he's already spending a lot of time for us. So we don't want to give any burden, unnecessary burden to him. So kindly mute your videos. And if anyone have doubt, please, at the end, the platform will be open for you. We can clarify. Okay. And
Thank you.
once again, I would like to remember Father Saleen in this moment. Thank you, Father, for this great opportunity. I hope that this will help to improve myself, and I'm very happy to share my knowledge to others as well. So it's an OET writing overview. Okay, so today I'm not going to discuss any case notes. As we are considering for the beginners, we are just going to discuss about the overview. Like, if you get a case note, how can you approach that case note without any fear? Okay, I hope that it will benefit you, and let's see. Okay, several response as your responsibility. Mute your mic, mute your audio and video. Expect you to be present here until the end. Respect the privacy of each individual. Be respectful in your communication. You are always welcome to interrupt the teacher for clarification. And if you need to draw the attention of your teacher, raise your hands and unmute your audio if you want to speak. And remember to mute again your audio soon after you're speaking. Okay. Yes, friends, try to practice on official sample writing booklet. I'm not telling you to practice every day into the official paper, but at least 10 to 15 letters you must write in an official writing paper. Why? Because this official paper is, the lines are bits congested than our normal book. So if you are with a big handwriting, or if you have a very small handwriting, for the reader, for the examiner, they will not feel happy, or they will not be pleasant with your answers. So the overall look also has got very great importance in our writing. So in order to practice that one, you need to practice on the official writing booklet itself, so that you will know that your handwriting is whether it is legible or it is clear, or whether how the lines are follows and everything, how to leave the space in between the lines and where to reach, like a in I will show you the official paper now. Yeah, this is the official paper. See the lines between the lines, it is a bit congested than the normal paper. So you need to be very careful, those who have a big handwriting. So, and not only that, when you write, usually when we write the essays and all those things, we start from the middle of the line, isn't it? Like in the school days, we have done that. But in OET, we have to start from the beginning itself. See, from this part itself, sorry. From the beginning itself. Do not leave any space. But between the paragraph, you must leave a line, okay? So that they can know that you have divided the paragraph. And maximum line should be like around to 24 to 25 lines, or it is bit like a little more also, up to 26 lines and all, no problem. But it is this page and the next page until like 1/4 is okay. No need until half, even until 1/4 or bit more than 1/4 is okay to write in order to complete an essay with all the relevant notes. Okay, so regarding paper, I would like to request you to start writing in an official letter if you are nearing to the exams, and make sure that your handwriting is comfortable in that letter, and all the all the rules and regulations how to write onto the letter. Okay, so as we all know that OET doesn't give any template to follow while writing. Okay, since we don't have a template, our beloved father Saleen has guided with the ISBAR method to write it or to make a better letter to us. So what is ISBAR method? ISBAR is an international tool of communication which follows everywhere. I think even in India, during the handing over and taking over, we follow ISBAR method. And everywhere like Europe, Middle East, everywhere we follow ISBAR method for handing over and taking over, or communication between any healthcare providers. So during OET letters also, if you follow ISBAR method, you will know that whether you have completed all your tasks very well or not. Like, what is ISBAR method? It is I for introduce an identity, S for situation, B for background, A for assessment, R for request. In introduce an identity, what are the things you need to include? Like patient details, name, age, and address. Well, coming to the situation, medical history, family medical history, and lifestyle of the patient. Background, hospital treatment and record, and assessment, observation, and the last, request. Sometimes we may not follow the same pattern. It comes according to who is our reader. Reader, either it can be a doctor or nurse, or it can be a social worker or dietitian or anybody. For example, if it is a social worker, you may have to include social notes on the introduction paragraph itself. Okay, because the social note is important there. Or if it is a doctor or if it is a nurse, then like a patient history has to come in front. So this comes the steps has sometimes it may come jumble, but you must make sure that you have included all these points in your letter. So again, in order to write a better letter, follow ISBAR method. It will really help you. And in order to more about ISBAR method, please refer to the father's video. He had done multiple videos regarding the writing in a very, very wonderful way. He had explained everything in detail. Please watch it. You will get more ideas regarding to that. And yes. When you get a letter, you must know that, how much mark are you going to get into this letter? We are not a school students, to write simply simply and finish it off. you must analyze your letter, whether my letter is capable to get this much mark, or you need to assess it yourself. Am I eligible for B score? So in order to get B score, you must know that how much mark you need to get in each part of writing. The part of writing means they have divided our content in a like a special paragraph, which I will be discussing later on. So before that, just see that the purpose paragraph, our first paragraph, we need to score 0 to 3 marks, between 0 to 3 marks. Okay, the content 0 to 7 marks, and conciseness and clarity, you need to have 0 to the mark is between 0 to 7 marks, and organization is 0 to 7. Honor and style 0 to 7. Language is again, I think, 0 to 7. Okay. So this is the way they have divided the mark, and in order to get the B score, we must get between 350 to 420, and out of this 0 to 3, you need to get to get a B score, and all other criteria you need to get 5. The mark they divided is between 0 to 7, and in order to get B score, we need to have 5 marks. So I think it is clear for all of you. So let's move to the next slide. So what's the time frame for writing? Like the total time frame is 45 minutes. And then the first, you know that when you, this is the third part. Yeah, the last part is our writing exam in an OET writing day, exam day. So the first 5 minutes is the reading time. They will not, the examiners or the assessors, they will not allow us to take pencil or anything during that 5 minutes. It is a reading time. We must read the case notes carefully. Like that time, you need to use it wisely in order to fulfill, in order to, to divide your points, to understand whether it is relevant or irrelevant or semi-relevant. In order to know that, read it wisely for the 5 minutes, and then next 5 minutes, out of this 45 minutes, you divide your time. First 5 minutes for reading. Of course, as I said, that they will not let you to take pencil or anything. Next 5 minutes, they will tell you can start writing, but you just take another 5 minutes or little less than that in order to make a mind map in your mind, like a map in your mind. What is mind map? That means like make a clear picture what I'm going to write. Okay, if I'm going to write purpose like this, how the introduction paragraph am I going to start? Or what can be my social paragraph? Or is my request paragraph is going to be big? You need to make a mind map. Or at the back of the paper, only first and second page they will evaluate on the OET writing. On the third page, back of the page, you can write, you can make a mind map. Just quickly you can write purpose 1, 2, 3, 4. I'm going to include all these data onto the purpose, and my introduction paragraph, I feel that it is big, so I need to make it 2, divide into 2, and then go to the social paragraph. If I'm making like if I'm making writing all these data together, it will be big enough, so divide into 2, and then social and request paragraph. And there itself you can think, oh, if it is for a social, better to put social data in the front. So there you can, once you start writing, it will be like, very difficult for you to erase and writing, and your time will go fast and you will be panicked and you cannot finish it anything. So make a mind map or make a rough notes at the back of the paper and then start writing. Then another 30 minutes till you have to write. 30 minutes for writing. First 5 minutes reading, second again 5 minutes for mind map, and then another 30 minutes you have for writing. Still another 5 minutes we have for proofreading. And the last, why we need to do proofreading? It is very important because we may make many mistakes. Because as you all know that the exam is we all will be in tension during the exam time. We may do the gender mistake or like some small grammatical errors and all those things which can be corrected. So the last 5 minutes, use it wisely to, to do the gender check and small grammatical errors and all those things. Okay, so I hope that it is clear for you. Going to the next slides, word limit. Word limit 180 to 200 words, and it's not very strict. If it goes little beyond also no problem, but try not to include any irrelevant data on our letter. Okay, so again, coming to little more general instructions, include all relevant information and avoid irrelevant information. And all, okay, so how will you take relevant and irrelevant information? For a beginner, please listen. Like, always keep in your mind who is our reader. Like for example, doctor is our reader or nurse is our reader. So is this doctor need to know all those things, or is this nurse need to know all those things in order to give better care to this patient? Or imagine you are a doctor. When you receive a letter, imagine that, do I need to know this information to give better care to this patient? So you need to ask yourself, do I need to know this point? No, maybe sometimes no. Oh, why should I know this regarding, for example, we are referring a patient, critical patient who has sudden bleeding or meningitis, some critical patient, or a motor vehicle accident patient to a neurosurgeon or some specialty doctor. Is this all this social paragraph is important for this patient, or like his chickenpox history and all his relevant past information is relevant to this reader? So you need to ask yourself that, do I need to know this information? No, I need to give immediate care to this patient. So I don't need all this past like a chickenpox or measles or this history. So such information, if you feel that your word length is more, you can omit it. Okay, that is what about relevant and irrelevant, semi-relevant. So irrelevant means it is totally irrelevant. Do not include at all in your letter. And then semi-relevant means you can include to some extent, and you need to check, where is my word length? Is it my letter is going to be big enough, or it may be boring for the reader? So in that case, you can omit that semi-relevant information also. Or sometimes if you feel that your letter is very small, then you can include those semi-relevant information to the letters. I hope it is clear. The next point is always leave a line between the paragraph. As I said that, when you finish with intro paragraph and if you want to start with the additional paragraph, leave a line between the paragraph, and each paragraph, here each paragraph must have a single theme. It means that try not to include all the social data into the first introduction paragraph, and try not to include this social data onto the request paragraph. So this request paragraph is especially for request, and social paragraph is for social paragraph, and introductory paragraph is for introductory paragraph. So that's what that means. And avoid long sentences. Okay, OET doesn't ask us to write a long sentences. They tell us to make it short sentence, but write it in a meaningful way. Okay, use punctuations appropriately. In order to give a good meaning, you need to use punctuations clearly. Make sure you use correct tense, forms, and articles. Of course, this is very important. This is one of the main things which they are assessing us. We need to use articles properly, and tense properly. Of course, for that you need to have a competency. That is what, when you write your letter, just assess, am I using the tense properly there? Regarding the tense and articles and all, Father had done the videos, and you can watch you will get a clear information which tends to be used in which area, and all those things you will get it from the YouTube. And again, the first 5 minutes while reading, read your writing task. Read. First thing what you need to read is your writing task. Select relevant information, avoid irrelevant information, and organize our letter. Okay, friends. Now again, while coming to ISBAR, I would like to tell you that it's an international accredited tool. Okay, fine. I just want to tell you that this letter we are writing, either it can be a nurse to nurse, nurse to doctor, it can be a nurse to allied healthcare professional, means other healthcare professionals like a technician, X-ray technician, lab technician, or any other city technician, or anybody from the health professional, or doctors to doctor. I know that I'm sure that many of us had read multiple times the reference letters. We know the format of writing the letters. Doctors also will follow the same letters in our clinical settings. Here in India or in Middle East, we don't have a customs to write nurse to nurse letters, but in Europe, I think they have a letter customs to write nurse to nurse letter. That is what they are asking this type of letter for us in the exam. So we need to have a competency on such letters as well. My concern is when you get a letter, even when you go back to your clinical practice, you just read a reference letter or reference letter from the doctor, which is written from the clinic or any other doctor. Doctors follows the same format. First, they will see the patient, they will do the assessment, they will check the vital signs, and they will do the investigation, treatment, the same method which we are going to follow this OET writing as well. Okay, we will see on my coming slides regarding that. Okay, and friends, these 7 components you must keep in your mind. As I said, that the exam situation is little, it's a bit panicking atmosphere for all of us. So make sure that you have completed these 7 steps, 7 components successfully in your OET letter. That is date, address, salutation, reference, intro paragraph, most important information, secondary information, social, conclusion, yours sincerely, and your designation. Okay, so these 7 components, make sure that if it is there in your letter, it can be one of the best letter. So how to write these 7 components, I'll be discussing later. Okay, so before going to that, again, writing method. For writing, step 1, ask yourself. This, you may feel that little bit repetition to these slides, but these are the things which you need to know, as a beginner. Then once you get the case note, most of the case notes are same. Once you are thorough with this point, it will be easy for you to proceed with the case notes. Okay, friends. So step 1 is ask yourself, does the recipient know the patient? So you need to know, you need to identify, is it whether it is a known case or unknown case. Most of the time, they will clearly say that patient's own GP, or he had come from his own facility, where maybe patient was there for the last 5 years on the same aged care facility, then shifted to hospital. Previously, I know that people used to say that identifying the known case or unknown case is very challenging, but I don't feel that nowadays there's friends say that it is easy. They don't give in a much complicated way. They will write PT, comma is patient's own GP, or patient had come from the same facility, or the address. With the address also, we can identify whether it is a known case or unknown case. Then, if I were the recipient, or as I said earlier, what would I want to know, or how would I want the information be organized? I had already explained on the step 1 points. And step 2, what is relevant, what is semi-relevant, what is irrelevant. Already we had finished with this. And step 3, organizing the case notes, like introduction. Yes, include main medical issues onto the introduction. Okay. Then secondary details. If we have secondary details, you can debate the para and then write it. Then you can social paragraph and then request paragraph. Then step 4, transforming the case notes. Here it is the challenging part for the nurses. As friends, we are as we all know that in the many of us are studied in the Malayalam medium, and we are not very competent to write it in very big letters and all those things. So this is the little challenging part for us. That is why we are getting less scores in the OET writing. So your part is to to create a competence on transforming the single case notes to a meaningful grammatical sentence. Okay, so if you are keep on practicing onto this area, you can achieve your score. Okay. So as I said that in the first slides, I have shown you a case note and the where the writing task is located. So immediately you get a case note in your letter. So what you need to do first? Look on as I said, the first 5 minutes is for reading, and you have everything in your mind, and you have done mind mapping. Then while doing this reading, what and all, sometimes they write some irrelevant information also onto the writing task, which is not needed. So you should be able to pick up the points from the writing task. Do not spend all your time while reading each and every line of writing tasks. So your talent is to pick up the points. So what are you going to pick up? Who is our reader? So if you are practicing in this way regularly, it will be very easy for you to pick up onto the exam day as well. Who is our reader? Who is the reader? Okay, my reader. So you just took his name, whether it is a known case or unknown case. Am I able to identify whether it is a known case or unknown case from this writing task? Okay, purpose of the letter. Mostly 90% of the letter they give purpose on the writing task itself, but sometimes they give just below the discharge plan, in between the discharge plan and writing task. So you can, if you are not clear with the purpose on the writing task, you can either look onto the discharge plan and then, or just below the discharge plan, it will be clearly written purpose of the letter, and the reader name is given or not. Sometimes they give reader name, sometimes they don't give the reader name. So why do we need to know reader name? Like if we know the reader name, the last part, our sincerely and faithfully part will differs. So if we know the reader name, then we write sincerely, and if we don't know, we write faithfully. It goes, if you don't know the reader name, it goes more official way, then we write faithfully. I hope it is clear for you. When I come to that part, I'll discuss again. Then what is the diagnosis? Mostly from the writing task itself, we can take the diagnosis as well. If you didn't get the diagnosis, you need to look for the diagnosis. So this just pick up like that. Who is my reader? Whether it is a known case, purpose of the letter, reader name, and the diagnosis. If this is clear in your mind, it will be easy for you to write, to make a very good purpose paragraph. And regarding the writer, like for example, you are a writer, you need to know who you are. Am I a registered nurse? Am I a charge nurse, or somewhere like a school nurse? Or who am I? And which hospital am I belong to? Whether, like, sometimes when the address, when it matched together, from there itself also we can identify the known case or unknown case. Okay, so I hope that this part is clear. This is very important part. When you get a writing task, please concentrate these points from the writing task, pick up, and it will be easy for you to, it will not take much time to create a good, excellent purpose paragraph. If our purpose paragraph is very clear, it makes sense. Okay, they think that the student is able to write. Okay, now, so we have read the writing task, and we have everything is clear in our mind what I'm going to write. Now let's start with date. Okay, as you all know that we are starting with the date, or it can be address or date. You can write it in either way. First date and then address, or address and then date. You can write it in both way. Both is correct. And let's discuss with the date. Okay. Friends, you can see multiple formats of writing dates. Okay, many of that format also correct, but for me, like, I personally believe that this is one of the simple format which you can follow during the exam day, because why I said so is like some people put the date at the end of the comma at the end of the date. When you put comma, you need to put the comma in throughout the letters. It may be, while continuing writing, you may be panic, or you may be like, it may be a little bit challenging for you. So better to avoid all this confusion. But you may forget to put the date there, so comma there. So better to avoid all those commas in between and while putting the date. So you can simply write 02, like if it is a single digit, you need to put 0 in the beginning, 02 January, or if it suppose it is if it is a January 2012, or 12 February 2012. Okay, if it is 2-digit number, you need to write it 12 February 2012. And mostly exam date, they will give like assume today's date is, I remember to tell you that nowadays mostly they are giving the date of 8 January 2000. They write today, assume today's date is 8 January 2000. The year I forgot. Okay, something like that, 8 January something. Okay, they write in the top itself, assume today's date is like that. So whatever it is, try not to put any commas or anything and try to follow this format. And regarding the dates, address and everything, father had explained very well in his videos. Please watch it. This is a very shortcut of his videos. Okay, if you are a beginner, please watch those videos very carefully. Okay, then comes when we come to address. Okay, how to write the address? As I said, from the writing task, you must pick the reader address. Okay, reader. So Dr. Hiren Halford. Okay, sometimes they give the doctor's name, so you can write Dr. Hiren Halford. That also keep that letter. What's that? Official writing paper in your mind, and you need to start from the very beginning of that paper. Dr. Hiren Halford, general practitioner, so and so. Okay, then you need to follow all those things very clearly without any spelling mistake from the very beginning of that paper. Okay, do not put any commas or anything on the address line. And some people say that actually it's not there in this address. For your information, if you get 4-digit number onto the address, don't try to write it alone in the last line. You can add along with the previous line. There also don't put any commas, because it again will confuse. We are not putting any commas anywhere. You can just add along with the previous line. These are, since as again I would like to highlight you that since OET doesn't have any templates, we can follow a common method. So Dr. Hiren Halford, then continue with the address. Or if the doctor name is not given, okay, suppose that they didn't give the doctor name, you can start with the general practitioner. The article should be there. You cannot simply write the general practitioner. You must add the before the general practitioner. Or the community health nurse. The article should be there along with the designation, if you are going to write the designation. Okay, I hope it is clear for you. And then welcome into salutation. Okay, yeah, like you can write dear nurse if it is for a nurse. Okay, dear Sandra, like for example, it is for a nurse, but the nurse name is there, so you can write dear Sandra, but remember to put comma at the end of the salutation. Okay, I just don't write the nurse in the bracket. I just put like, for you, for the reference. If it is a nurse and the name is given, you can write the second name of the, because already in the address we have written the full name, so you can write the second name of the reader, dear Sandra. Okay, dear Dr. Alfred. Alfred is his second name. Imagine his name is Thomas Alfred. Write his second name, dear Dr. Alfred. Do not put any commas or anything in between the doctor and Mr. and all those things. Okay, dear Mr. Alfred. Dear, if the name nothing is given, you can write, if it is so official letter, you can write dear sir or madam, comma. Okay, we don't know who is the gender. In that case, you can write dear sir or madam. I feel that it makes sense on you. I'm moving to next slides. It's a very vast presentation. We are still in the beginning. So if you have doubts, please keep it right and keep it. We will come back to the same slides and we'll clarify. Okay, then we'll come to the reference. Reference, RE, colon MS Anne Maria. Suppose our patient name is Anne Maria. Okay, you can write Miss Anne Maria. Okay, full name of the patient, Miss Anne Maria, and then Mrs. Anne Marie. Suppose we know that this patient is already married and widowed and all the it's married, living with a family and all those things. You can put, and they are given in the most of the time they are giving Miss or Mrs. You can add Mrs. MRS, Mrs. Anne Maria. Okay, so try remember, even if there is in the question paper there is full stop, don't put any full stop on your letter because you're not practicing putting full stop or dots anywhere in the letter. So try to avoid that. And then if below 18, you can just simply write Anne Maria. Fine. Then coming to date of birth, 10 January, the same format before use here also, 10 January 2012. You can use that 10 January 2012. Or if the age is given, you can write age at 50. Okay, age at 50. Reference RE, Miss Anne Maria, comma, aged 50. Okay. Or in case if date of birth and age is given, both is given, you can choose better date of birth. Okay. Then use second name if the patient is above 18. Like, you know, while writing the letter, you use second name if the patient is above 18, and if below 18 means use first name. Like for example, from Miss Anne Maria, if the patient is above 18, you can use Miss Maria, and below 18, you can use Miss Anne. I hope it is clear for you. And yes, we have done with our first introductory things like date, address, reference, and salutation. Now coming to the purpose paragraph. Okay, purpose paragraph. As I said that it is the mark is between 0 to 3, and we need to have a mark 2 in order to get B score. And then how to write a better purpose paragraph. Regarding this purpose paragraph, Father had taken a class for the purpose paragraph itself. Please watch those videos in order to get more information. This is a simple format of that. And in this purpose paragraph, well, it is better to minimize to 4 lines. Though it should be very clear and concise. Don't write everything into the purpose paragraph. Exactly what you need to convey to the reader. Okay, so we should be very competent in writing the purpose paragraph. So as I said, that 4 line is enough. And then what will you write in the first line? Okay, from here it is going a bit complicated. Please listen carefully. Those who I know that it's a bit lengthy class, try to make a notes if you are feeling boring or anything, just to refresh yourself. Okay, first line. Again, I would like to tell you these are not templates, and Father Saleen never recommend any templates in OET writing. Please mute your audio. Okay, he never recommend us to by heart the letter and to practice, or he never recommend to follow any templates. But this is like for a very beginner, I feel that it will help you. And when you write, all the case notes are different. I'm not telling you while watching this video you cannot write 100% good letter, but you need to use it very wisely. All the case notes are different. We have seen hundreds of case notes, and all the case notes are different. It's one or other way different. So this sentence you can use very wisely onto that situation. Okay, you should choose which one is better. Like the one who knows English very well, you can use your own format. Please don't follow everyone have their own knowledge, skills, and writing. You may be much better than me. I'm just sharing my knowledge, and this is just my own knowledge I'm putting here. So if you have a better knowledge, kindly share to us so that others also will get benefit of that. Okay, so how will we write the first line of the purpose paragraph? You can use many formats are there. So like I'm writing, if it is for a reference letter, you can first you need to assess which type of letter it is, whether it is a reference letter, whether it is a discharge letter, whether it is a whether it is a non-case patient. That I forgot to put you here also. Okay, so you need to, that is what I said, to use it wisely. I am writing to refer. If it is a reference letter, you can simply write I am writing to refer. It's for nurse to nurse, if it is for a nurse to nurse. Okay, or if it is for a doctor, you can write thank you for seeing, like we are in advance telling to the doctor that thank you for seeing, or thank you for accepting, or this is to introduce. Or if it is a known case, you can say that I am writing to update you. I didn't put it here, but you can write it like if it is for a known case, you can say that I am writing to update you the current health status of, because it is a known case, he knows everything about the patient. So just updating the information. I am writing to you to update the current health status of so and so. So this you need to pick up wisely. So I hope it is clear for you. Then you can use full name of the patient. Like in the first purpose para, you can write full name of the patient. So I am writing to refer Mr. Miss Anne Maria, okay, full name of the patient, who requires Miss Anne Maria, because who requires Miss Anne Maria requires, how to use this who requires, or they require. Sometimes we say that they require. That is the third sentence. No, not third sentence, third word, I can say that. The third part, who requires means like if the subject is singular, you need to use who requires. Okay, if the subject is plural, you need to say they require. Like for example, in case of mother and baby, you need to say they require. So the first line, you can say I'm writing to refer full name of the patient, Miss Anne Maria, who requires. Okay, or otherwise, mother and baby, they require. Okay. Okay, then you need to take the purpose from the writing task. As per the OET 2.0, they said as to highlight the purpose in the purpose, the first line itself, in the purpose paragraph itself. What is the purpose? Mostly 95% of the time it will be clearly mentioned, or you need to identify what is, if 2-3 purposes are there, what is the most important purpose. So your competent, that is your competency to pick up the purpose. You can paraphrase and write it, or if you are not able to paraphrase, you can use the same sentence as well. Okay, who monitor, some example I have put it here, but don't follow the same things. You can use your own knowledge. For monitoring and management, for further you can write further monitoring and management, further follow-up and treatment, continuing care and management. This way it goes. So these are the, mostly it will be the purpose for continuing care and management, or for urgent intervention. I cannot write it everything here. There are a lot, so I just put some examples. For urgent management, okay, if you are writing to a specialist for an urgent care, you can write it that, you can say that for urgent management. Urgent intervention, you can write that urgent intervention, or immediate management and care. This way you can choose the purpose. Okay, so you can write combine our sentence, like for example, I'm writing to refer Mr. X, who requires monitoring and further monitoring and management, or further follow-up and treatment. Okay, then see, along with that, you can add one more line, like saying that nowadays we write like a date of discharge, following his discharge today, or he will be discharged after 2 days. So better to make it 2 sentences. Don't go for 3 sentences. Even you can write it 3 sentences, no harm, but better you can combine along with the previous sentence. Okay, so along with the first sentence itself, you can add following his discharge today, following his discharge today. Or you can write or if he is being discharged today. Okay, so this sentence you can add along with either first sentence or second sentence, but use it wisely, and you just see the what is the purpose, just see what is the date, or he will be discharging tomorrow, like that you can add it. Okay, these things are very clearly explained by father, so please watch it there. Okay, the second sentence again, the diagnosis, we need to write the diagnosis. So he was diagnosed. Okay, there are different type of writing, like he was diagnosed or he has been diagnosed. He was diagnosed means short-term diagnosis. Like I can say that, what is short-term diagnosis? The things which can completely cure. As you all are nurses, and I don't think that much explanation is needed for this, but I can simply say that pneumonia, urinary tract infection, upper respiratory tract infection, all these things are the short-term diagnosis. You can use it here. He was diagnosed. The second time you can use he, she, or whoever it is. No need to copy the name again. Correct? He was diagnosed with a pneumonia and being discharged and is being discharged today. You can put our discharge date along with this one, so the reader will know how soon the patient is coming to his facility. Okay. Then sometimes he has been diagnosed. We need to write he has been diagnosed. Okay, that is for the long-term diagnosis. What is long-term diagnosis? Like for example, cancer, diabetes mellitus, which cannot be completely curable. It needs long-term care. Okay, so in that time we can put he has been diagnosed with the diabetes mellitus, or he has been diagnosed with the multiple sclerosis. There are many diagnoses which you know. I know that you know about that, so you can use wisely he was diagnosed or he has been diagnosed. Then when you write this diagnosis, right, sometimes we make a mistake of writing a capital letter in the diagnosis. You can use small letters. Okay, small letters are fine, but there are cases like there are some name of the diagnosis which comes along with the the person's name, the one who found the disease. Like for example, Gilbert syndrome, Parkinson's disease, Jacob's disease, so many other diseases. These diseases comes with along with their name. So in that case, you need to use the capital letter. So there you use the capital letter. Otherwise, you use small letters. I hope it is clear for you. Okay. For a beginner, if you feel complicated, please bear with me, because it's a very vast topic, and later on I will discuss with you, like, you know, if you need any special slides. Okay. Okay. Or then, like for example, I have discussed like if it is a medical diagnosis. Suppose imagine if it is a surgery, the patient had undergone any surgery. In that case, you can say that he is recuperating from, or she is recuperating from, or she is recovering from. Okay, from the surgery. The article should be there, from the left hip, that the body part name also should be there. Okay, left hip replacement surgery. Okay, left, or if you are writing simply the surgery, you need to use the article, or left hip replacement surgery. So you can write it like that. You can use either word of recuperating or recovering from, both are correct. So now we have done with our purpose paragraph. So purpose should be clear and diagnosis should be clear in the purpose paragraph. While reading the purpose paragraph itself, the reader will know that why we are referring the patient, what is the diagnosis of this patient. So he will get an overall idea of this patient. Okay, I hope it is clear for you. So now I am moving to next slides. With introductory paragraph, how to write a good introduction to a letter. Okay. Suppose many of us have doubt where to start the introduction paragraph. Some people say that to start with acute things, like on that day's incident, or some people say that to start with the initial things. So actually both make sense, and like you use it wisely. Like for example, if it is an acute case, like for example, fall, bleeding, sudden onset of any disease, or if it is an urgent referral to any specialist, in that case, you can say that it's an urgent referral, that specific things has to be urgently dealt with this patient. So you can write on that day's task, specially to that first paragraph. Okay. Or you are writing to you are writing about a chronic case. This patient had so and so problems, and yeah, still with the same problem. In that case, like a chronic case, like example asthma, you know that the asthma and all, since childhood asthma, it prolonged to these things. You can say that initially this patient had so and so symptoms, blah blah blah, then it leads to what, and then it on today's visit, final paragraph, you can write on today's visit it happened to, that story you can write. Always, whatever way you write, you make it as a story, because it will really interest to it will give interest to the reader, either it is today's or the previous one, whatever way, try to make it as a story. Okay. Okay, fine. Again, let's start. Let's go one by one again. While starting with the introduction paragraph, you can start with the patient name. Start with the name, okay? Like Miss Anne Maria, okay? You can write also, Miss Maria, because in the purpose paragraph we have written the full name of the patient, and then introductory para, you can start with second name of the patient if patient is above 18. Okay, fine. Then Miss Maria, okay, was admitted to the hospital. Was admitted. You see, I have highlighted with was admitted, presented, and represented. Okay, every sentence has got a meaning and sense, so you must use it wisely when you choose these sentences. So since if you have a good practice with all those things, it will be during the exam time, no need to think of all those things, you can simply just draw a line. Okay, so was admitted means how you will identify whether it is a was admitted, sorry, was admitted, presented, or represented. Was admitted means like patient was admitted by someone. Okay, like in friends, let me tell you again that in OET case note we usually use passive notes. Okay, active notes are there and passive notes are there, but in OET case notes we usually use passive notes. Because why? Most of the things are done by someone else to the patient. Okay, isn't it? You know that for the patient it might be done by a doctor or a nurse or other allied healthcare professional or someone else, for the caregiver or someone else. So it is done by somebody else. So you know that if you know about passive voice, it is done by somebody else. Okay, so here you can say that if I'm going in detail of that, it will consume a lot of our time. So I'm not going much into that. So you can see that was admitted. The patient was admitted by someone. Okay. Then if the patient came to the emergency multiple times, okay, then you can say that presented. Patient came presented to the emergency multiple times. Or represented. Patient came again, represented. Patient second time he came to the emergency. So presented, represented, was admitted. Okay, I hope it is clear for you. And then there are very rarely there is one case note, you can see that that is one more or somebody self-admitted one, they have given self-admitted. It's very rarely they don't ask, we don't see, other than that case note we didn't see any case note. Self-admitted means patient came by herself. Okay, but usually was admitted, you can write that the patient got admitted in the hospital means was admitted with someone to hospital. Use this to hospital. How to use this hospital or to the hospital? There are two things. Like if you want to write it generally, you can write to hospital. If you want to specify any name of the hospital, to St. Joseph Hospital. Like if they had given clearly in the case note to specify the name of the hospital, in that case you need to write to St. Joseph Hospital, for example. Okay, otherwise to hospital with the complaints of, so since we are like, for example, if you have many complaints, you can write that complaints. See, yes, with the there is a plural, complaints of. Okay, you know that in the case notes there will be many complaints for one patient. So how to arrange in a systematic way? You can choose like a pickup one by one and by one. So first take one and then use and as a conjunction, and then you can write one more. Okay, Then while coming next slide, I will explain more about that. So I hope this part is clear. Okay. Yes, 1, 2, and 3 complaint. Okay. Then if again more complaints are there, you can say that in addition, she has 1, 2, along with 3. Like, so when do you use all these complaints? Like when it becomes all irrelevant data. If you are writing to a specialist, if you are writing to a doctor, it's an urgent referral. Doctor must know all these complaints of the patient. Or if it is a treated complaint, or all those things are finished, like if we are referring to dietitian or a social worker or a nurse, sometimes even a nurse, no need to write all those complaints. Okay, just a nurse, in the sense nurse we must write, but see that whether it is everything is treated and your letter is very lengthy and all these things, you need to choose it very wisely. So you can write it. In addition, she has again if there is complaint. Okay, in addition, she has again 1, 2 along with 3. Okay, for example, fever for 2 days, nausea and vomiting. Okay, in addition, she has breathing difficulty of breathing, painful micturition along with low urine output. Okay, so for a reader it will be interesting to read. So if you are arranging in such a way, I hope it is clear for you. Okay, so if we have multiple complaints, those parties, if we have multiple complaints, like for example, if patient comes with only 1 complaint, fever for 4 days. Okay, so with a complaint of, so you can write simply with a complaint of, or with the complaint of. Both we can use, with a complaint of or with the complaint. So that's enough. Then you write only 1 complaint. I hope it is clear. And then, like, see, like a fall or fracture, these things are not complaint. Okay, so we need to know, how to identify all those things. Like you can say that admitted to hospital following a fall. Okay, so you need to, don't write that admitted to hospital with a complaint of fall, with the admitted to hospital following a fall. Okay, or you can write admitted to hospital with a fracture of left elbow due to motor vehicle accident. Okay, so the reader will know from there itself why it happened. So admitted to hospital with fracture of left elbow due to motor vehicle accident. I hope it is clear. Okay, so the first sentence we have written from the introduction paragraph, first sentence, it is, I have explained the complaints, how to write the complaints. So first the name, start with the name, and to the hospital, how to was admitted, how to identify that it is finished, and to hospital, it is already explained. And then regarding the complaints, I have explained 2, 3, 4, 5 methods regarding the complaints. And that sentence is, once you have done with that sentence, and then what to do next? See, imagine for a doctor, if he get a patient, what he does, he assess all the complaints. What he's going to do next? He's going to examine the patient. Okay, so someone else told the patient these are the complaint of the patient. So now he's going to assess the patient. That's what we are going to write in OET exam paper also. So on examination, or on assessment, or on observation, we can put many word there, like those words there. Okay, then put a comma there after on examination. She appears. Okay, that patient appears. Okay, how she appears? Lethargic. You can put lethargic, weak, and restless. How did you find that patient that time on admission time? Or you can, instead of she appears, you can put she looks pale. Okay, or you can say that she has breathing difficulty. Okay, these things you can apply there, but use it according to the scenario. Okay, so this second sentence, it can be either one of them, on examination or on assessment, on observation, with a she appears, all those things. Okay, then after assessing, doctor need to check the vital signs. Okay, he should know what is the vital signs of the patient. It's normal clinical setting, these things are going on. So you can say that her vital signs were deranged if it is the past. Okay, it is already past and we are writing the letter later on. You can say that her vital signs were deranged, or you can say that if it is all deranged, or if it is only one single parameter is deranged, you can say that her temperature was 39 degrees Celsius, or you can say that her temperature is elevated to 39 degrees Celsius. All these things you can put on that sentence. Okay, then okay, so we have certain complaints from the patient. We have assessed the patient. There also we felt that patient is very weak and yeah, her temperature is elevated. So what doctor usually what he does? He will go for investigation, isn't it? You know that in the clinical settings we do the same. So let's go for investigation. Therefore, a series of investigation were performed. A series of investigation. If it is a series means a group of investigations were performed for this patient, or a chest X-ray, because sometimes they will do only one investigation. A chest X-ray was performed for the patient, or a CT scan was performed for the patient and confirmed the diagnosis. So you can use this sentence. Okay. Or you can say that a series of investigation confirmed the diagnosis. Therefore, he underwent the surgery. Okay. In order to make it simple, you can in order to reduce your word limit, you can say that a series of investigation confirmed the diagnosis and therefore he underwent the surgery. So I hope it is clear for you. Okay. So we have done with the first part. Patient came, complained, on examination, vital signs finished, and investigation done. So of course we do management for the patient. So during hospitalization, what we have done for the specific patient, or post-operatively, two things. If the patient had undergone any surgery, you can say that post-operatively. Post-operatively is a hyphenated word. Do not forget to put the hyphen there. And both these words are, you need to put comma after that. Okay. You can use either if it is a medical diagnosis during hospitalization, or the other one like this post-operatively. Okay, what care was given to this specific patient? For example, I have just simply put it, physiotherapy was initiated for her along with some other therapy. Okay, I just put therapy or some other therapy. If there is two therapy, you can just mix together. You can write it. Physiotherapy was initiated. Why we have written, as I said, that passive notes, it is initiated by someone else, not the patient by herself. So it is initiated by physiotherapist. So physiotherapist was initiated for her along with hot therapy. Or you can say that dressing was performed for her with the gelonate ointment. If it is important to reader to know what type of dressing it is, you can write it. Dressing was performed for her with gelonate ointment. I hope it makes sense on you. And okay, of course we give medicine to the patient. So what type of medication, regarding the medication, let's see. Medication, she has been commenced on. Like, regarding the medication, we can write it in three way as well. Like, for example, if the medication, it's no need to continue anymore. In that case, you can write the last sentence. Her pain was managed with paracetamol, or her pain was managed with something else. You can write the name of the medicine there. Okay. If the reader need to know this, like for example, if you are writing to a dietitian, please don't write all those things. Or pain was managed with analgesics. Okay. Simply you can write it. Okay. She was like if otherwise you can write she was prescribed with the paracetamol 500 mg, paracetamol, 500 mg twice daily. That was also that thing is finished. No need to continue anymore. Okay, was prescribed and she is okay. It's gone. Okay. Oh, if you want to continue this medication, she has been commenced on, augmentin, 500 mg once daily, semicolon, baclofen, 75 mg twice, and paracetamol according to the dose. You can write it here, like here also. Or sometimes they specify how many days to continue for another 5 days. You can write along with this. So from the discharge plan, like, if you feel that the discharge plan is very lengthy and there are lots of points on the discharge plan, you can write it along with that. So no need to repetition is, please completely you need to avoid the repetition. No need to again to repeat on the discharge plan, or if the discharge plan, if you feel that it is very short, that is why we are doing the mind map from the beginning, that whether the data is to be included wherever it is. So if you feel that that is very big, then in that case you can write it along with this to continue for another 5 more days. Okay, so while writing the medicine, you can just put first comma. This medicine also, you see, don't write this A, always write with small letters. Okay, my mistake, I have put A capital. You can write small letter, augmented. A start with a small letter, and B, yeah, baclofen small letter, P paracetamol small letter. All medicines start. Previously we used to write it this generic name, I think something capital letters and all those things. Nowadays you can write all the letters, because it is really confusing. We don't follow, like, unless we are a pharmacist or somebody, we don't follow this all this generic name or brand name, all those things. It will really make us confused during the exam time. So you can simply put so small letters for this medicine name, and the commas put wisely, see, comma. And this daily, see, in the question maybe they gave once in a day, so you can put it daily, once in a day. How many words are there? See, so you can, if you put daily, you can minimize those word count, and twice a day. Or you can, when if they have given the question twice a day, you can just put simply twice. That is enough. Okay, so I hope it is clear for you regarding the medication. Okay, so we have done with our first paragraph. If you feel that my paragraph is very lengthy, or if you write one paragraph, no problem, it is very accepted. But if you feel that it's very lengthy paragraph, the maximum line should be 5 to 6 lines in a paragraph. And if you feel that it's lengthy, so divide into second paragraph if there is more information. Like, for example, let me tell you, you can say that in addition, or simply you can say that the only thing what you need to know is, when you start a second paragraph, leave a line and start with the patient name. Okay, Miss Maria is able to mobilize a few steps. She's able to mobilize a few steps. However, she requires assistance in daily living activities. However, she requires assistance in daily living. Okay, so still she need assistance. This, however, we can use it in a two way, like either by with a small letter H, putting comma here with starting with a small letter H, or you can use it as another sentence as well. Both it is correct. Okay, or you can say that additionally she's able to mobilize, or if you want to say some additional information, you can start in the second paragraph. And in the end, you can say that, or otherwise, currently, what is the current health status of the patient? She has made good progress. Currently, she has made good progress, or she is progressing well. Okay. So I hope it is clear for you. So we have done with our introductory paragraph. This is for a simple case notes. See, there are many risky case notes, so we need to use our every points very carefully. So it's for a simple case notes for a very beginner, so you can use wisely. Okay, as I said here, I have written maximum 5 to 6 lines, and write the name of the patient in each paragraph. Okay, fine. Okay, next comes to social paragraph. Okay, social paragraph, from the beginning I have told you that if it is for a social worker, use social paragraph from the beginning, or you can use as a third paragraph. Okay, for social paragraph, you can use simple present tense. Okay, so what simple present tense? You can say that Miss Maria lives with his family. When you write each sentence from the social paragraph, and you ask yourself whether it is really needed for the reader to know all those things, because in the case note they may confuse us by giving so much of data about the social things. Most of the things will be irrelevant. So whether this reader is really needed this point or not, ask yourself. Or you can say that Miss Maria is a primary school child. Maria is a widow, or like that. You can start with the Maria lives with his family, or this sentence you can use as a first sentence, and the second sentence you can say that she likes, or she loves to play chess. This sentence you can mainly use, like, for example, we are referring to a patient to long care facilities. Like there, they need to know the patient likes and dislikes and all those things. They need to give a better care to the patient. But in the case, like if it is an urgent referral, all these things are not needed. Okay. So she loves to play chess and all those things. You can write it. Then you need to include smoking and alcohol or diet history. Then you can use there also. You need to use wisely. If it is like we are writing the letter for, like for example, smoking cessation. In that case, don't write. You need to elaborate and write regarding the smoking things. Or if our letter is regarding the alcohol consumption and all those things, then in that case you need to elaborate and write. Or otherwise you can just write in one point that she smokes and consumes alcohol moderately. Or if you feel that the reader should know that, like for example, cancer, lung cancer, so you need to show to the doctor that this patient is a chronic chain smoker. So in that case, you can write that the number of cigarettes which he had used previously. All those things you can use it. Otherwise, you can simply write it moderately, or she smokes in excess and consume alcohol moderately, like two different things. She smokes in excess and consume alcohol moderately, two different things. You can use it. You can these things you need to check according to the writing task. And there one more thing which we can add is the Boolean Max Syntax. It's a social program.